The short webinar on the types of dental implants and their problems is about to begin. Hello, my name is Joe Johnson and welcome to this short video or webinar on dental implants and the types of dental implant. If you don't know me, there is a video on YouTube called Dental Implant Secrets, and it's all about the problems that you can have with dental implants, and that's been watched over 500,000 times. I've helped a lot of people avoid problems with dental implants, and hopefully I can help you now. I am not an expert, I'm not a dentist. Only a dentist can tell you which type of dental implant is best for your mouth. Because what they've got to do is this. They're going to put, look at these teeth here. Fantastic. I'm in my 60s and I've got a set of teeth that look like I'm in my 20s. They're fantastic. I've had a dental plate, I've had dentures before this, and there's no comparison. Dental implants are fantastic and they're well worth having, but there's some problems that you can avoid if you go into it now, before you have them fitted. The first thing is, choose the right dentist. Now, to be a dentist, it's a very, very highly qualified profession. But even within that profession, there are people who specialise in implants. It's up to you, but I would suggest, if you can, choose a dentist who's got a lot of experience doing implants. Because implants are a relatively new field, you know, in the last 10, 20 years. But things have changed a lot in the last 5 years. And the technology behind dental implants is changing all the time. And so choose a dentist who is aware of these changes in technology and who has practiced on somebody else. That's the thing. Choose a dentist who's practiced on somebody else, made the mistakes on somebody else, so that when you go along, the dentist knows the best way of choosing the best dental implant for you and then fitting it to avoid the problems. Now, there are two types of problems. So, choose a dentist who's experienced. It might cost you more. Personally, I would suggest it's worth it. So you go along to the dentist, they'll do a thorough examination of your mouth. They look at your existing teeth, they look at the gums, but then they have to look at the jaw underneath. The jaw at the top, the jaw at the bottom. Because it's your jaw that the implants are going into. So what they're going to do, they're going to pull out any existing teeth, they're going to open up your gums and go into your jaw. Now, in my case, my jaws weren't big enough, or the bone structure, it wasn't big enough to screw into. So I had bone grafts. I had bits of bone grafted into my gums, and then it was all stitched up, and we had to wait several months while it all healed again, and then I went back and then they did the dental implant. So the first problem that you can avoid is, first of all, pick a good dentist who's experienced. Then pick a dentist who's going to do all the exploration and offer you the best type of dental implant which is best for you. Nobody else can tell you. I can't decide, and you can't really decide what's best for you. Only a dental professional can tell you what's best for you. But hopefully they'll sit down and explain. You may need bone grafts. You might be all right to have a dental implant done straight away. I don't know. So let's assume you've gone along to the dentist. They've explored around your mouth and they said, right, you need this particular type of dental implant, or implants in my case. I've got tons of them and it's fantastic. But your dentist is then assuming if you need a bone graft, they're going to actually have to remove the gums back, put the bone graft in, stitch it all up. There's your first problem. A lot of people who get a bone graft then get a gum infection. And if you look at my other videos, you'll see my face literally like a football, as I've swollen up with gum infection caused by the bone graft. Now, the dentist I used was a very well qualified, very experienced dentist. So he did a good job. But he just said, look, it's the way it goes. Sometimes you will get a gum infection, and I did. Very painful, very unpleasant. But he treated me with antibiotics. The first lot didn't work. Went back a few days, about a week later. I said, oh, all right, we'll give you another set, so much stronger. And eventually, the gum infection started to go down. I'll come back to that. So when I was ready, several months later, this is what they did. And this is what they'll do with all types of all types of dental implants. This is the general gist of what they do. So here is your jaw, the bone. This is the bone of your jaw. They cut in through your gums and they drill into your jaw and they tap or they screw into the bone. So they put the dental implant in here and they come through your gums. Can you see that on the drawing? This green area here is your gums. And then they screw into this a tooth like that. They come down and it screws into this thing here. Yeah? See that? So if there's any problem in the future, so this thing's screwed into here. If that breaks off, there's no problem. They just clean it up and screw you another tooth on. So that's how it works. And it's fantastic having these implants. But the problem is, most problems aren't caused by this. It's not caused by this. It's caused by this small area here, where the dental implant comes through the gums. Can you see that? It's here. So your gums are here, and the dental implant sticks through. In this area here, your biggest enemy is bacteria. And that's what happens. The bacteria get in here. So when you have your dental implant, no matter what type you have, they will, as a matter of course, give you antibiotics. And the reason is this. Your mouth will be traumatized. You'll have lots of swelling and it's painful. But I'm telling you, it is worth it. But you're going to get bacteria in here. So your dentist will give you antibiotics to help prevent gum infection or implantitis or peri-implantitis, as they call it. Peri-implantitis. Peri meaning around, implantitis. Around your implant, you will get a gum infection, almost certainly. People, more often than not, get a gum infection, which is treated with antibiotics. But the problem is, like in my case, the antibiotics didn't work. And as I say, you can see that other video where my head's like a football and I was in a real mess. And it can be avoided. And I'll show you how to do it. I've been working with natural remedies for over 25 years, way before implants were even invented. And I've been helping people with gum infection for over 20 years. And it's very easy to treat if you know how. Now, I'll tell you a short story here. Roman soldiers, when they were in Italy and they invaded everywhere across Europe, and these thousands of Roman soldiers were issued with a shield, you know, and a sword and armour, but they were also issued with some plant extracts. And every Roman soldier had to carry these plant extracts, and the reason was, if they were cut with a sword and they got infected, more often than not they would die. Yet the Romans knew that there were certain plant extracts in nature that would kill off the bacteria on contact. So it was the most ancient form of antibiotics. And these antibiotics, these natural antibiotics, didn't damage your immune system. So the way I treated myself, and I've helped tens of thousands of other people with implants, is even before you get your implants, get this gum formula. In here are these plant extracts that I've told you about, but also there are 4 homeopathic remedies to treat gum infection in this same remedy. And it's just, if you can see here, it's just a clear liquid. I don't know if you can see that on there. It's just a clear, very powerful liquid. And it kills off bacteria on contact. Now what you do is, if you have the bone graft, first of all, if you have the bone grafts, and you may need about, I don't know the percentages, about half the people need a bone graft of some kind. So your dentist will cut into your gums, put the bone graft in and stitch it all up again. I'm suggesting to you, you put a couple of drops of this onto your gums. It'll kill off the bacteria on contact. It won't interfere with the stitches, the sutures. That'll keep you from getting a gum infection. You're going to go back several months later. Your dentist then is going to do the next stage. He's going to drill into the jaw, fit the dental implant, and then fit the crown on top. Now this is where most people now are experiencing their problems. They get the dental implants, they go through all the pain and misery, because there is quite a bit, but it's worth it. Look, they are fantastic, but you've got to avoid gum infection, because otherwise, if you get infection in here, it starts to rot away and the dental implant will have to come out, and then you can't have another one. I'll say that again. If you get dental implants and then you get an infection here, you can lose your dental implants. You have to come out, and then it's very difficult then for the dentist to fit you another dental implant, so you're going back to having a dental plate or dentures. So this is what you do. When you have the implants fitted, they will give you the antibiotics, but start to use this gum formula and just put a couple of drops onto your gums, onto that area here. So it's like, if I could show you, this area here is covered with the natural antibiotics, and it stops you from getting peri-implantitis. And you can go on Google and have a look round. It's been described as an epidemic, and it's like, they don't know why. The dentists don't know why. People who've had implants for 5 or 10 years, the body, it's as if, and it's not, I'm not saying this is exactly how it is, but it's as if the body is rejecting the implant, because they start to get infection here and here. They treat it with antibiotics. The antibiotics will work for about a month or so, and then they get infected again. And plenty of people are losing their implants, and it can be avoided. What you do, you have your implants, use the antibiotics by all means, but then use this stuff once a day, whether you have got infection or not, because it prevents, it's the only thing out there that prevents you from getting implantitis. Just a couple of, so in the morning I get up, clean my teeth, do that, that's it. It goes onto this border here, onto this area here, where the gum meets the implant. Just put it on. It kills off your bacteria on contact. So it freshens the breath. I go out during the day, fine. I come home at night, you know, before I go to bed, clean my teeth, put a couple of drops on, and that's it. I'm never going to get implantitis. I'm never going to lose my implants to a gum infection. And that's it. So it doesn't really matter what type. Your dentist will tell you what type of implant to get, but it's up to you to keep those implants in good condition. It's up to you. It's not your dentist's job. It's your job to keep your gums clean. You need to stop the bacteria getting in the border, getting down into your gums. It's up to you to do that. Now a mouthwash won't do it, a toothbrush won't do it, so what are you going to do? You don't want to be taking antibiotics because it weakens your immune system, and there's all kinds of side effects. So use this gum formula. That's it. It's very quick, simple and easy to use. It's non-toxic. You can carry it, a child can use it, anybody can use it. Just keep it in your pocket. If you've had the implants, you're going to, for the first month, your mouth will be quite tender. Use this every day. It won't affect the stitches. It'll harden your gums a lot quicker. It stops your gums from bleeding. It hardens your gums, and it stops your gums from receding. It toughens up your gums in this area. And that's it. They're the only problems that you're going to have. If you choose the right dentist, choose the right dentist. If it costs that bit more, personally I would pay the extra. Do everything that your dentist says, but on top of that, put the gum formula onto your gums. It's the most powerful natural antibiotic you can get without damaging your immune system. And just keep it with you, make it a part of your everyday. Well, you've seen how easy it is to use. Look, that's it. It freshens your breath. You can keep it in the bathroom, keep it in the car, wherever, you know, just make it a part of your everyday life. So you'll end up, like me, old with beautiful teeth. don't get gum infection, okay? Now, you can get the gum formula from homeopathicremedyfinder.com. I'll say that again, homeopathicremedyfinder.com. There should be a link below this webinar. And if you go to that, if you have any questions, go to the website, send me an email, or there's a phone number there if you want to ring us up. And if you want any help, I can't offer you any dental advice because I'm not a dentist. But I'm somebody who's had very real experience of implants and real experience of peri-implantitis. See the other video where my head's like the size of a football. I've never had gum infection since in all those years, and I've helped thousands of other people to, you know, to get your implants and keep them and look pretty for the rest of your life. Okay, well, is there anything else? That's it. There's a phone number on the site, there's an email on the site, but more importantly, homeopathicremedyfinder.com, the link's below this webinar. Get it, make it a part of your everyday life and enjoy having implants. If you haven't got them yet, I would definitely recommend getting them. They're fantastic. Okay, any questions, give us a call. All right, bye for now. So I hope you liked this video and this webinar. I hope you found the information useful. Please use the information and you'll soon start to feel better. Now, could you do us a favour? Please subscribe so that the next time I put a video out, you'll automatically be informed. You know, we'll give you plenty of tips and plenty of advice to help you with this condition. Now, also, could you please click like? It helps us. And then the last thing is, if you've got something to say, any comment, positive or negative, please leave a message underneath this video. And also, if you know somebody who's got this condition who might benefit from watching this video, please share this with them or share this channel with them. We're here to help, okay? And also you can visit our websites. We've got a couple of websites. There's homeopathicremedyfinder.com or healthproductsbusiness.com, and there's plenty of information there. And if you want to get in touch, either email me or leave us a message on the phone and we'll get back to you. All right, thanks very much. Bye for now.